Okay, we're going to continue on the subject of women's health with a founder who in 2015 launched a network of women's health clinics with the goal of offering her clients, her patients, affordable, comprehensive care. And she joins us now to talk about recent milestones in women's health and the challenges that remain from the gender gap in investment and the enduring lack of research when it comes to health issues that impact women. Please welcome Dr. Somi Javed, a board-certified obstetrician-gynecologist and founder of the US-based Her MD healthcare clinics. Oh, we're going over this way. So many seats.
Let's
Dr.
find
Javed.
each other. Hi.
Hi, come sit down.
How
You've
are
got
you?
your clicker because I believe we're going to have some slides. But hello, let's start first of all with the origins of Her MD for anyone in the room who isn't familiar. So I mentioned that it was founded in 2015 in response to gaps that you had seen in the healthcare system, both as a practitioner, but also because of your personal family experience. Tell me more.
You're already going to make me cry.
No, well, we can cry. There's nothing
Yeah.
to do with crying.
I literally got a call that was my calling in life. It was my father. He said, Somi, you need to come home. My mother, who was only 45 at the time, had been complaining of left arm pain, shortness of breath, and chest pain. We were in Cleveland, Ohio at the time, the home of cardiovascular care. And what her doctors had told her was caffeine, her children, ended up being
The stress of her children.
Yeah, us, apparently. Ended up being 4-vessel disease. Had the heart attack come, my mother would have died. I was pre-med at Northwestern at the time, 21 years old, and made a promise to her and to myself that this was never going to happen again, and that I was going to change the world. Little did I know what I had promised to do. Fast forward, medical school residency, got my first job in the US healthcare system. I was seeing 50 patients a day. That long ago promise of changing the world and advocacy was gone. And so when the timing was right, bought a clinic, opened my doors to a provider patient-centric clinic specializing in survivorship, menopause, gynecology in Cincinnati, Ohio. And soon we attracted women from 35 states and 3 countries.
And you say opened a clinic as if it was the easiest thing you ever did. I know that you had to raise a lot of money to do that, and women's healthcare is a notoriously difficult sector to attract investment in. What was that process like for you?
Well, they told me as a dinosaur because I was over 40. We won't say how many years above 40. A woman from the Midwest of color, that I had a 0.37% chance of raising funds.
Wow.
And the truth is less than 2% of VC dollars go to female founders. And so can we throw up some slides and I'll share some statistics of what I was standing up against.
We're going to see, we should be able to see the slides on these screens to the left and right of the stage. Let's click through to the next one, please.
Okay.
Somi, you can see them down
I can see it down there, but I was hoping, can you all see it up there?
They've also got screens in front of them.
Okay, so basically, in the United States, why should we care? Around the world, there's 1 billion of us in menopause right now. Menopause lasts a day, but then it's the 12 months.
Menopause lasts a day.
Yes,
Wow.
but then it's the day after 12 months of no menses, but then the rest of your life is postmenopausal. And we're graduating in the United States 93% of our medical residents with the inability to take care of you in this stage. And it's way beyond gynecologic care. We now know that Alzheimer's affects women 2 to 1, and we are now identifying the changes in the brain due to estrogen receptors and that decline. So menopause affects us from head to toe. Undiagnosed, untreated menopause led to, just in the United States, $1.8 billion losses in work. Women are in the prime of their lives. I'm going to be 50 in a few weeks. I don't want to be sidelined by menopause. They are leaving work because of undiagnosed, untreated symptoms like brain fog, word finding, cognitive decline, because we're outliving our ovaries. The other barriers to care, I teach a lot of providers. They're given 5 to 7 minutes with their patients. How are you going to talk about these topics that have had stigma, taboo, and shame, even in the United States? Perform a physical exam, make sure you type it all up, put it in the electronic health record. I mentioned the funding. I told you in the United States, less than 2% of VC dollars go to female-founded companies. Globally, only 5% of research dollars went to research and development. And we need more than pharma. We need more than surgery. I'm a surgeon. We need more direct-to-consumer devices that collect data, that really puts healthcare in the hands of women. And in the United States, women were not mandated to be in clinical research trials until 1993.
Which speaks to this huge lack of research around conditions that impact women, or how they respond to conditions that impact men and women.
So we can switch that off, but you're right, we were treating women in the United States like little men. So that's why my mother almost died. Cardiovascular disease remains the #1 killer of women in the United States. And did you know that women are more likely to die of a heart attack than a man? And the gender of the providing physician affects your outcome. Meaning, if your cardiologist is a man, you are more likely to die. Is that not crazy? Because we're not believed. Like my mother was not believed.
Crazy and scary.
And unacceptable.
And unacceptable. So what are some of the solutions to this? Obviously, you with HerMD tried to and have succeeded in rolling out a possible solution to this in terms of women having comprehensive healthcare, having longer appointment times as well, which is a very key element. If we're thinking globally, you know, the women in these rooms, what tools, what information can we give them today to leave feeling a bit more empowered about their health?
Yeah, so let's fix the educational gap, right? I mentioned that 93% of medical residents are graduating with no education in where you and I are going to spend 40% of our lives if we're lucky enough. So we created something called HerMD University, where we internally train all of our providers so that there were no delays in diagnosis, needless suffering, and we were able to treat our patients. We are going to be licensing that, so we are going to start training providers all over the country, not just HerMD providers, and then also educating our patients. We have a lot of female leadership. Even though we outnumber men in the workforce, about 75% of the healthcare workforce is female, but only 25% of us hold healthcare leadership positions. And we're also physician-led. And there, you know, we were talking about healthcare innovation. And what is one of the #1 barriers, even if it's the best idea, is adoption. If the providers don't adopt the new technology, the new surgery, the new pharmacotherapy, and someone said 17-year gap. Some of it's regulatory, but a lot of it's adoption. If a provider cannot figure out how to operationalize it, it's never going to be implemented. So we've gotten around that. And then when people told me, well, we're not going to cover that, that's experimental, we took matters into our own hands, collected data across 115,000 patient encounters, and presented it at major medical conferences so that it was peer-reviewed and people could understand how we were doing things differently, truly making the patient the CEO of her care, along with the providers, and creating this curated plan that was different than the status quo.
Now, earlier this year, you announced that HerMD was moving completely virtual. You were closing your clinics. Tell us a bit about why you had to do that, because I think it speaks to a bigger story about where we are in the women's healthcare journey right now.
Absolutely. So it's all about reading, you know, I never imagined I would say this as a doctor, but reading the market, understanding what's going on, and kind of meeting the patient where they're at. And as we were seeing reimbursements decline and medical costs go up, the cost of maintaining clinics, even though I know women need to be seen physically, just was not sustainable. Plus our wait lists, as I mentioned, our original clinic, Cincinnati, Ohio, is not known for medical tourism, and women were coming from 35 states and 3 countries. And so we wanted to meet women where they were and expand our access. And to do that, we wanted to be less capital intensive, use the capital we had to expand nationwide, hopefully globally one day.
Hopefully globally.
Yes.
Playing devil's advocate, some people might say, how can I get the same standard of care when I'm behind a computer screen?
Right, and so doubling down on virtual care is not new at HerMD. We've been doing it actually since before COVID because so many people were traveling to us. But I don't know if you guys just saw this, the FDA last week approved Teal, the first ever at-home Pap test. There is now a new FDA-cleared device, I just saw it this week, that performs 9 physical exams. There's genetic testing, there's genomic testing, there's cancer testing. You can assess cardiovascular disease. So there's a lot of things that we can do rendering femtech, AI, and seeing the patient over Zoom. And then the other thing that we plan on doing is partnerships with hospital systems and physical clinics in the areas where we're going to provide care. And honestly, they want to concentrate on what their providers are trained on, whether it's the obstetric care, whether it's the primary care, and they really want to allow us to take care of the menopause solutions, and then also partnering with employers so that we can take care of their employees.
Are there any questions in the audience for Dr. Javed? If not, Betsabe, I'm going to come to you because can we get a microphone here to Betsabe, please, in the front of the room? Because earlier this morning, she cornered me outside to tell me some very interesting news about funding that is funding/a prize that is targeting ovarian health. Yes. Tell us more and why it's important.
So I sit on the Brain Trust for X Prize, and last year in the Visioneering, this is for people who don't know, X Prize initiated 20 plus years ago, the Ansari X Prize, the first private space flight. So that's where we are today, 20 years later. Last year, for the first time ever, ovarian health was the prize of the year. So that's what actually has been launched a few days ago, and it's fantastic because it goes beyond maternal and menopause. It goes to this organ that hasn't been really fully studied for half the population around the world get impacted by it. And ovarian biology is the center of this, and it's called the XX Prize, which is fantastic.
That is amazing news and goes right along with this interest in longevity because people are like, why should we care about ovarian health? Well, for the first time ever, as we are living longer, we're outliving our ovaries. And we mentioned on the last panel that we are living longer, but you know that women live longer than men, but we live those years in much poorer health. And so if we can integrate hormonal health and understand our ovaries much better, it's a key to longevity and not just living longer, but living those years healthier.
I want to leave the women in this room with some tangible things they can do to take control of their health, to maybe start thinking about longevity if they haven't already. I mentioned in the previous panel, in the UK and the US, longevity started as a very white male conversation. It's now happily spreading, and we've got more women taking control of the narrative. 3 tips from you, Dr. Javed, for the women in this room as to how to take control of their health.
Number 1, find a provider who specializes, if you are in the perimenopause and menopause phase of your life, find someone who specializes in that. Number 2, track your symptoms, head to toe. I was talking last night at dinner, frozen shoulder is a sign of perimenopause and menopause. Brain fog, word finding, sleep disturbances. Your provider can't meet you halfway unless you are tracking your own symptoms. I always tell patients, no one knows your body better than you do. And then number 3, do not be afraid of femtech innovation. A lot of it is very accessible. Whether it's a swab test you could do at home, there's a great company called Tally Health. It tells you your genomic age. And then I have one last one.
Go.
Lifestyle. Make sure you lift weights. It's amazing what you can do to protect muscle mass and bone density. The mortality from a hip fracture is 20%. Walking with a weighted vest 11 minutes a day can change that outcome for you. So very, very important to take care of your bones.
And I know that you give out great advice and expertise on Instagram as well, so I would suggest that people find you there if they want to hear more. Thank you so much, Dr. Javed, for coming to speak to us. We really appreciate it.
Thank you.